Good afternoon, everyone. Happy June the 8th. This is Eric, and we are getting ready for the third webinar in our Safe and Drug-Free School series. We are glad and excited that you all could be here today. We apologize for having to reschedule this session. We know that many of you were scheduled to be here on the 25th and we're here, and we thank you for your accommodations and substitutions. I was having some audio technical difficulties and was not able to project any audio due to having a new laptop, but we have gotten that fixed. So hopefully everybody can hear me and see me. So I'm going to throw out a quick question in the chat just to make sure that you all can hear me. As well as if all of you can see the beginning slide, the title slide for the PowerPoint. So if any of you can respond to that to let me know that things are good and working on your end, that would be a big help to me.
Eric, it seems like the audience doesn't have access to the chat, but in the question box,
Okay.
we're getting a lot of yeses and
Okay, sounds great. Well, in that case, we will go ahead and proceed on. So let me go ahead and go ahead. For those of you that may have been with us and those of you that were not with us previously, just to go over a recap, in Module 1, we talked about the history of the Drug-Free Schools and Campuses Act. We covered the primary requirements. We talked about the elements of certification, and we talked about how monitoring and enforcement and sanctioning of the act had changed since the act originated in the late 80s, early 90s, and really what the current monitoring and enforcement is looking like and how the Department of Education is handling that. In the last session that we had on session 2, we really focused on what is referred to as the Drug and Alcohol Prevention Program Notice. And we talked about the required elements of that notice, which is primarily the standards of conduct, the applicable sanctions that your institution applies, the different health risk of drugs and substances commonly used and abused on your campus, the list and inventory of interventions and programs and services that are available on your campus, or if they're not available on your campus, maybe those services and programs that are available in your community, as well as a disciplinary statement. And then we talked a little bit about who should receive that notification, ways that that notification could be distributed, and generally what is considered best practice. When we think about today's session objective, when we think about the mandate of the Drug-Free Schools and Campuses Act, it says that we have to have a substance abuse program. But when the act was created and developed, there was not a lot of clarity, there was not a lot of specification as to what a substance abuse program looks like, what it entails, what are the elements of that program. The thought at the time was that universities and colleges should be given some latitude to develop a program based upon their needs, the problems and issues that they're seeing, as well as the strengths and assets that they have in addressing the particular culture that existed on everybody's unique campuses. And that's a little bit different than what we see in some of the current legislative mandates that are being created today. For example, when we look at some of the revisions to the Clery Act, has a little bit more definition, a little bit more prescription as to what we should be doing in terms of addressing crime, in terms of addressing sexual violence, and those types of things. So today's session is really going to be taking a more generalized look and offering you some ideas and some suggestions of what a substance abuse program may look like in consideration of the current science and research of prevention, evidence-informed and evidence-based practices, the NIAAA's New College Alcohol Intervention. We continue to call it new because it's the latest iteration of guidance that they have presented, even though that intervention matrix has been out for several years. And then we'll also talk a little bit about professional standards and models that you may use in program development in terms of creating a comprehensive program, and then how these all can help set the stage for your biennial review process, which is actually the main focus of session 4 and next week's session. So I always like to start this program by what is meant by program. And
Hey,
what
Eric,
I'd like, yeah.
I hate to cut you off, but the slides have gone away. Now we're just seeing this blue bar across the screen. I'm not sure if you exited
Okay.
out or clicked something, but
No, but let me. You seen anything now?
yeah, now we have the slides again.
Okay. Not certain what happened there. Okay. If it happens again, let me know. Okay.
Okay.
Okay. Awesome. So, I like to ask people what is meant by program, and knowing that the question box works for everybody. If everybody could just open up the question box, and in that box, if you were asked what is program mean to you, what is a program? When you think about this mandate, what does a program mean? How would you answer that question if an administrator asked you that question in relationship to this mandate? As answers are coming in, what we're seeing is, that's a really good question, had not thought about it. Something that is intended to change behavior, a variety of things ranging from education, prevention, group and individual services, presentations, strategies, et cetera, aimed at substance use, misuse. So a wide variety of things. So when we think about this particular act, it gets real interesting because, again, the Department of Ed really does not give us clear guidance. In some aspects, the Drug and Alcohol Prevention Program notice at some level constitutes the program. The Department of Ed has said on some occasions that notice constitutes the minimal level of programming that an institution should do.
Hey, Eric.
And
The
Is it still?
presentation slides are, yeah, we have this funny bar across the screen again.
I
Sorry,
do
man.
not know what's happening. Let me do. What are you seeing anything now?
Now it's a gray bar.
When I'm looking at my screen,
This is now we have your PowerPoint slides. We can see the slide and then the slides off to the side.
what have you got now?
Now we just have the what is meant by program slide.
Okay, let's try that.
Okay.
Okay, so let's try this and see what that does. Again, the day app may be considered by some to be the minimal level of programming. When we think about it in terms of health education, health promotion, evidence-based practice, we know that that notice probably is not going to be effective as a behavior change agent. It's probably not going to be very effective at changing the culture. So we probably need to be doing more than just providing that particular notice to our students, staff, and faculty. So I would strongly urge campuses to do more than just providing that notice. It may meet the mark of minimal compliance, but really in order of doing best practice, due diligence, making campus healthier and safer, there really needs to be a more comprehensive program. And I think that's really where it becomes key. I've been to some campuses where I've done some assessment as well as some consultations, and I've said, tell me about your program. And they've really thought that substance abuse programming is really intended to be individual and small group based programs, presentations, lectures. And that was really all that they had done, that they had not done anything more beyond that in terms of policy review, of law enforcement, of sanctioning. So really it is a much larger process than just delivering education and awareness type activities. When we think about when this act was created in the late 80s and where we are now in 2022, a lot has changed. We know a lot more about evidence-based programming, and we really have to think about the spirit of the act and realize that things have changed, really look at the current best practices and the science of prevention, and really try to move more toward filling the spirit of the law than the letter of the law. So I won't ask you to speak out or write in the text box, but I would ask you to think about, as a rhetorical question, you know, if someone from off campus came to you and said, how would you describe your comprehensive substance use program? What would be your response? What would be the major elements that you would describe or tell that individual about? Would it be just educational programs, awareness programs? Would you talk about your policies? Is the slideshow up again or is it down again?
Slideshow is good.
Okay, I just saw that, Michael, I've got the questions up so that way if somebody pops up and it's down, I can see it a little bit more quickly. But you know, how would you describe your substance use program? Is it policies? Are there any interventions? Are you doing any screening of your students? Students that screen highly, are there ways to provide any type of student assistance or support? How are policies monitored on your campus? How are policies enforced? What happens to students, staff, and faculty that may not be in compliance with policies? Does your program just stay on campus, or do you do things off campus? Do your policies have any impact on things that occur off campus? Does off-campus behavior fall under the umbrella of your policies that you have? So there's a lot of things to think about as you think about a comprehensive substance use program. And really, when we think about next week and we talk about the biennial review process is really assessing and evaluating your comprehensive substance use program. So whatever it is that you've created and the different elements that you have in this masterpiece of substance use prevention that you have developed, as well as the continuum of care that you've created, that's what you're going to come back to during your biennial review process to measure and evaluate. So again, if you go out and talk to other folks on your campus and you use the word program and you ask them, well, what do you think our substance use program is and what does it look like? You'll probably get a wide variety of answers. And sometimes you'll probably hear outreach, awareness, marketing, one-time shots, services, collection of services, interventions, really no different than what we heard when I asked you that question. So again, some things to consider. What does it look like? Why do we deliver these interventions, these services, these programs? Who's responsible for overseeing it? You may have a lot of different elements and a lot of different departments or individuals on your campus responsible for overseeing these different aspects, these different services, these different programs. But it's important to think about how do those different individuals overseeing these different components work together, communicate, integrate, collaborate, because it really takes all of us working together to make this comprehensive program successful. What funding is allocated to deliver the program? Is funding centralized, or is it still kind of siloed and partitioned? And then what happens when funding is decreased, or someone who has typically funded a program no longer has the money to do it? Is that service or program gone to the wayside? Or is it institutionalized? Someone else picks it up, or does the vice president say this is important, so I'm going to find funding elsewhere from the institution? That becomes very important, and I see that happening more and more as funding becomes more and more difficult to obtain. Who's involved? What does it include? Who's the target audience? Who does it engage? What are the goals and outcomes? I can't stress goals and outcomes enough. A lot of times we will sit down and say, oh, we have this program and it's intended to reduce alcohol use. Okay, that's great. It's a good start, but what does alcohol use mean? How is alcohol use specific? How is it measured? Is alcohol use alcohol poisoning? The number of transports to the hospital? Is it BAC levels? The number of alcohol policy violations in a residence hall? Is it marijuana use? Is it illicit drugs? Is it knowledge and attitude change? Is it perceived norms or actual norms? There's just a lot of questions for you to consider. And a lot of these things will also not only help you develop and shape what your program is, but there are also things that can be taken into consideration when you get to your biennial review process and trying to determine whether or not your comprehensive substance use program is or is not having an impact on changing the culture of your campus. So again, when you're thinking about the problems that you're trying to address with your program, what is it that you're trying to impact? You know, a lot of times people will say, well, we're trying to reduce alcohol use, we're trying to reduce marijuana use, we're trying to reduce substance use. But again, what does that really look like? And when you bring your partners together on campus and you have that conversation, you'll probably find out that, you know, you may use the umbrella substance use, alcohol use, marijuana use, illicit drug use, but everybody coming to the table probably has a different variation of the issue or the problem that they really want to address. And if everybody's going after a different subset of the issue, it makes bringing everybody together kind of difficult. And that's where having a coalition is kind of like herding cats. And as you develop or revise or reevaluate your comprehensive program, it's really important to kind of figure out what are the main issues that we're wanting to challenge and address and change and try to get everybody on the same page. From that, you can also look at your goals. And as educational institutions, a lot of times our ultimate goals affect student success, education, our institutional missions, and we have to figure out how what we do in terms of addressing substance use ultimately impacts those larger institutional goals. I love logic models. That's a different presentation for a different time, but I would encourage those of you who have some familiarity with logic models to consider that as a planning model, as well as an assessment evaluation model when it comes to biennial review processes. And again, these are great questions of looking at your goals and assessing your goals, but I think they're great conversational points, especially if you have a task force, if you have a coalition. They allow you to kind of sit down and say, what is the intent of our comprehensive program? What are we doing? What have we done? What do we need to do differently? What is it that our administration feels we need to be doing? What does our key constituents feel that we need to be doing? What do different people feel important? What doesn't feel important? You know, why are we doing what we do? Again, very formative, but it will kind of help give you a strong foundation to give you some guidance as to making your comprehensive program better, but also helping you do a much better job when it comes time for the biennial review, assessment, and evaluation process. Again, as I talked about, you know, if you have a coalition or a task force and you bring people to the table and you ask them, you know, we're here to address substance use, everyone's going to have a different perspective, everyone's going to have a different issue, everyone's going to have a different priority. And sometimes people at the table can't even articulate what they see as a problem. And hopefully talking about what the comprehensive program is, as well as going through the biennial review process, can help better identify the strengths, weaknesses, opportunities, and weaknesses, and align some priorities among the table. So it's really important to be having these conversations with people on your campus. If you end up, you know, saying, well, I'm the Lone Ranger, I'm the only person that's doing this biennial review process, I'm a solo person in my health promotion office, and I'm the person that's really responsible for all the substance abuse prevention on campus, and I've been kind of given this task. I would really encourage you to take some time to reach out to some of your colleagues on campus, develop some relationships, build some allies, and really get some help, because this entire process should not be a one-person process. Whether it's developing and enhancing and maintaining a comprehensive program, or completing the biennial review process, or developing, revising, and distributing the drug and alcohol prevention program notice. These things really are not intended to be one-person actions. It really needs to be a collective, and there are a multitude of reasons for that. Again, I alluded to logic modeling a little bit earlier. I would suggest that wholeheartedly. Again, it's a much different presentation that would probably take about an hour just to describe, but it really starts with the end in mind, where you look at your outcomes, you look at your long term, then you go to your medium term and your short term, then you determine kind of your activities, then you determine what you need to put in to make those activities happen. And then once you've worked backwards, then you can move forward and kind of reverse the arrow and begin with your activities, and hopefully and logically everything will fall into line. It's a great planning model, and it also helps you develop an assessment and evaluation model. One of the expectations of the Drug-Free Schools and Campuses Act is that we program at different levels. So when we're programming, we're just not programming to, the students that are problematic or troublesome, those that we consider to be beer bullies or high at-risk drinkers or problematic drinkers, or that we're just programming to those students that are abstinent. But we're really programming to all different classifications of students. And it gets interesting because in my experience, we use a lot of different terms and definitions in higher education, and administrators like to use those terms as well. You'll see a lot of the terms that are thrown out there, and many times we use these interchangeably, and really what we know is that these are really, really different. So when you hear people talk about health education, it's really a planned learning experience, and that those experiences are used on theories and are really intended to help our students acquire information and skills. So probably a good component of your comprehensive program involves some health education. When we think about health promotion, health promotion is a little bit more different. Health education can be a part of health promotion, but health promotion is really a process that helps people increase control over and improve their health. And it's usually positive and proactive, and it usually moves beyond individual behavior, and it looks at social and environmental interventions. Many of you may have heard of the Okanagan Charter. It's getting a lot more popular, particularly in college health. There is a group called the U.S. Health Promoting Universities. I may have butchered the name, but it's a fairly new organization, and they're really looking at people, place, and I can't remember what the third P is. I'm fairly new to this concept, but it's a great concept. And again, health promotion is much more than just health education, and it's looking at more of social and environmental interventions and determinants than just delivering education. When we think of traditional substance abuse prevention and interventions, we think about awareness, we think about prevention, and we think about harm reduction. Those are fairly common terms, and awareness is knowledge and understanding that something is happening. Prevention is taking an action before a problem arises. We know that prevention has different tiers, and primary prevention is before any issue has happened at all. So that would typically be our students that are abstainers that have never used any substances. And harm reduction is a set of practices that many of our campuses employ and are really garnered for those students that have initiated substance use, but may not be well, could be dependent, but really trying to get them to lower their use and lower their negative consequences. One thing that I hear a lot is that health promotions, and if you talk to anyone who is engaged in health promotion, they do not like that S. Promotions with an S is a term that is really gained, not really gained, but it's really utilized for marketing. So, and the health promotion folks would say, marketing may be a tool that we use, but there's a difference between marketing and health promotion, and the work and the curriculum that we use and the training that we have. They would say marketing is really more intended to get people in the door of an activity and an event. Promotions are more like outreach activities and not necessarily the process of change and using theory. But we know that treatment without prevention is simply unsustainable. And that's why this particular act really focuses on prevention. That's not to sit there and say that campuses should not be also focusing on other things such as treatment and interventions and things like that. And I would recommend looking at the Institute of Sorry, my phone's ringing in the background. Institute of Medicine's model of prevention, looking at universal, selective, and indicated prevention. You'll see it goes to a lighter blue for case identification. So that's typically when we would have students that are using substances, have gotten in trouble. We've identified that they have issues. We're doing some kind of assessment, some kind of intervention. And along the way that we are moving to treatment and intervention, and then after they get through treatment, they may go into aftercare and rehab, which would then go into maintenance behaviors, which would then include our recovery populations. One of the things that we're beginning to see, and I think it's important for us in the substance use field, is that, you know, we use the term health a lot, and health is not primarily exclusively medical, clinical, individual, or illness based. And we're seeing a large movement in higher education to look at broader qualities, states of wellness, social justice, human dignity, things that are creating and enhancing capacity, and really looking at things at the population and community level. So when I was a teenager in the 80s, and there was a lot of things going on in substance abuse prevention, there was a lot of programming geared at information, awareness, individual level, small group level. And what you'll see has happened over the last 20, 30 years is that those things continue, and we have a lot of research on those individual interventions, but you'll see a lot of environmental strategies. And I think substance use in college settings have kind of led the way in this area. So there's really some great work and some great research that's been done. So if you're not familiar with the population and community level interventions in the substance abuse field in higher ed, I would really encourage you to look into those as part of your comprehensive program. One of the models that we would really encourage you as IHAC to look into, if you're not familiar with, is the social ecological model. This is a great model because it really covers 5 domains, and really, if you have a comprehensive substance use program, it will address all 5 layers of this model. Down at the bottom, you will see individual or intrapersonal, as it would be seen in several other variants of this model. We're looking at individuals, and we're looking at trying to change their knowledge, attitudes, and skills. The drug and alcohol prevention program notice would be an intervention that we might apply at this level. Basics would be an intervention that we would apply at this level. Providing knowledge, skill sets, doing information tables on serving sizes might also fit into that particular circle. The next circle is interpersonal. When I think of current programming, bystander interventions would fall under this because it would affect how individuals and friends may interact with one another. Social norming would also play into interpersonal, as it would affect how friends may interact with one another, how friends would perceive one another, how the social networks may engage in particular behaviors. When we start looking at the next 3 layers, we're looking at organizational. So for many of us, that would be our institution, and what and how we as institutions, whether it's our larger educational institution, our university, our campus, or our colleges, or our academic departments, our student affairs departments, what are the policies, what are the procedures, what are the protocols that we have within our organization to address substance use, to manage substance use, to respond to substance use. What are the cultural implications? What are our traditions? How do we respond to our traditions? Again, what you'll see is that we're beginning to focus more on the environment. We're focusing more on the larger picture and less on the individuals. And then we go to the next realm, and it's really kind of the community. And for many of us who have been in substance use for a long, long time, we're really used to looking at the interplay between our community that the university or college resides in and the organization level. We know that substance use does not stop at our boundaries. It crosses the boundary and often goes into the community or the region in which our universities and colleges reside. So we know that we have to kind of sit there and cross the lines and work with our community partners and our regional partners. And then we look at public policy, and those are national, state, and local laws. And the best example for that would be the minimal legal drinking age and the impact that that has had on use rates. When we look at federal policy and state policy and local policies on marijuana, that's probably the biggest impact that we're seeing on substance use now. We know that there's not alignment between federal policy and state policy, and that's creating some challenges for us in higher ed because there's not alignment and trying to figure out how to maintain and uphold the federal laws with the reality that many of our students, staff, and faculty may be living lives based upon state and local laws that are not in alignment with the federal laws. So, we've kind of talked a lot about comprehensive programs. I want to provide some standards to guide our work that some of you may be familiar with, and some standards that you may not be familiar with. The Department of Education, which monitors and oversees the Drug-Free Schools and Campuses Act, actually came out with a Principles of Program Effectiveness in 1998. Granted, this is 24 years old, but I think it provides a good base foundation for us to consider. This is mainly geared for K-12 populations, but I think the 4 primary tenets of these principles hold true to us in higher education. And I think when you look at them and compare them to the Drug-Free Schools Act expectations, you'll see a lot of overlap. For example, it says that we should be basing our prevention programs on needs assessment data. So it's good programming philosophy. We shouldn't be just doing programming. We should have some data to determine what our strengths and weaknesses are, what our needs are, where our problems reside, and we should be developing evidence-informed programs and interventions based upon the data that we have. We shouldn't be doing programming just to do programming, but we should have some goals and objectives set, and we should be measuring those goals and objectives, and we should be working toward those goals and objectives and trying to figure out whether or not we are being successful. When we're doing programs, we should be looking at the current research, we should be looking at the current evidence of effectiveness, and we should be looking at programs and policies and interventions that seem to have a higher degree of efficacy and applying those on our campuses. The body of research for substance use has increased. It's getting better. There's more research out there than there's ever been. We have learned a lot. Now, granted, there are some subpopulations that we don't have a lot of research about. So if anyone is thinking about going for a PhD, if anybody has some extra time and wants to do some research, community colleges and substance use on community colleges, there's not a lot of research out there, and we would love to see some more research in that particular area. So whether it's formal research, whether it's assessment or evaluation on your campus, if you are doing programming, you need to be doing some periodic evaluation related to your goals and objectives to determine what's happening. And again, when you look at these 4 principles, they really are intermeshed and intertwined with the expectations of the overall Drug-Free Schools and Campuses Act. One set of standards that I really like and I really love, and it's been a strong foundation for me when it comes to substance use programs on college campuses, is a set of standards created by a group that no longer exists, but that group used to be known as the Network of Colleges and Universities Committed to the Elimination of Drug and Alcohol Abuse. It was a voluntary membership organization. It was created by the Department of Ed. It was funded by the Department of Ed until there was something in terms of auditing or legal, and the Department of Ed was told that they could no longer fund it. And then it tried to continue to exist as a grassroots effort, and then it just kind of went away. But when we look at those particular standards, there were 5 standards. And the first standard was policy. The second standard was assistance. The third standard was enforcement. The fourth was assessment. The fifth was community collaboration. And when you look at these, policy, annually promulgate policy. That's our drug and alcohol prevention program notice. Develop policy that addresses individual behavior and group activities. Component of the day app. Define policy to guarantee the inclusion of all campus property. An expectation of the day app. Stipulate guidelines for marketing and hosting on and off campus sponsored events. Again, if you were with us a few weeks ago when we talked about the day app, we kind of talked about this at that point in time. State institutional commitment to the education and development of students, faculty, and staff regarding AODV issues. Not a part of the day app, but often part of our internal policies and why we exist and those types of things. Assistance, accurate current information on the adverse consequences related to the day app. Promote and support alcohol-free programming options. Many of our campuses do that through Student Life, through student activities, and if we have residence systems, through that network as well. Coordinate collaborative network of services to facilitate treatment and or referral services. Many campuses have on-campus treatment and referral services, and if we don't, we've got networks and memorandums of understanding with off-campus treatment providers to make referrals or to help our students get treatment for services off campus. Provide training programs for students, staff, and faculty. Peer education programs, peer support programs, just a lot of different things that are going on that can happen that exist. Orientation programs, many campuses do that as well. So again, many different components of student assistance. Enforcement. Most campuses will be enforcing alcohol and other drug violation and violence policies as a part of CLARI. They have consistent enforcement. So chances are you're probably meeting this standard as well. Assessment. I always find this interesting because folks with a clinical background think individual assessment, but this is really institutional assessment. So doing things such as surveys, looking at different data points, such as ambulance transports, alcohol policy violations, substance use policy violations in student athletics. next week when we talk about biennial reviews and data that can be collected. A large part of the biennial review process really relates to assessment. So how are you assessing your campus community, campus behaviors, attitudes, beliefs, values of students, staff, and faculty, pulling that data together to figure out what is going on your campus. And community collaboration. Again, this shouldn't be a solo office or a solo staff member's responsibility. It really works best when there's a group addressing it and looking at it together. And again, depending upon your campus, you know, if you're in a community, it probably should be a campus community group and bringing people from off campus, because your substance use issues probably just do not reside on campus, but also filter into the local municipality and region. Many of you may also be familiar with the American College Health Association. They also have standards of practice for health promotion in higher education. There is a document that they have that I would encourage many of you to look at, but when they look at their standards, they would ask, you know, how does your program align with the mission of higher education? Again, going back to social ecological based practice, do you have a social ecological based program? How do people collaborate within the campus to oversee your program? Is it inclusive of different individuals, different minorities, different races, different groups on campus? Do you have theories that your practice is based on? Again, are you using evidence-informed and evidence-based practice? Are those implementing the different components of your program? Are they getting the professional development that they need to stay up to date and abreast of information in the field? And are they contributing to service in the field as one way of having that professional development, but also as a way of sharpening the saw and being able to bring stuff back to your campus? It's a great set of standards. I've used it a good deal of my career, and I've been you know, involved with ACHA and seen very different revisions and iterations of this. But it's a set of standards that I think works really well with substance use. And again, we're suggesting these as a framework to your comprehensive program. You can use one, you can use two, you can use several, but it helps to have that framework. Many of you, especially if you're in the student affairs realm, may be familiar with the Council for the Advancement of Standards. There's probably about 40 to 50 different areas of standards that exist. There are specific standards for alcohol and other drug programs, counseling programs, health service programs, counseling programs. There is also cross-functional frameworks, so advancing health and well-being and identifying and responding behavioral concerns. So again, just a lot of different frameworks for functional areas. There's other frameworks for things like orientation, student life, residence life, pretty much any area within a student affairs framework that you can think of. But when we look at these standards, you'll see a lot of different areas. So they look at mission, they look at learning outcomes, leadership, human resources, diversity, equity, and access, finances, technology, facilities, a lot of main areas. So even if you're just doing the self-study component of the CAS and you're not bringing in external visitors to kind of do an external review, it's a great tool to use in evaluating and assessing a comprehensive program. And it can also be a valuable tool when you're looking at a biennial review process to give some structure. So again, when you're thinking of what is a program, what is our program, and what are the elements and components, again, these standards may help you develop a framework that, one, helps you instill better practice, but it may also help you have a better practice of a biennial review process. For those of you that may be familiar with health education, the National Commission for Health Education I just said credentialing. I probably have messed that up, and I shouldn't mess that up since I'm a member of that. They have some competency areas for health education. So assessment, planning, implementation, evaluation, advocacy, communication, leadership management, and ethics. So sometimes I've met some that are in health education that have used these as their framework when developing their substance use program. And again, it can be helpful. And again, I just use this as an example. And depending upon your area of professional practice, there may be some competencies and responsibilities that you may be able to use to develop your framework as well. The Department of Ed has also developed some things specific to effective substance use prevention. In 2007, they came out with a document called Experiences in Effective Prevention. This document was based upon 22 campus-based model programs that received funding in the late 90s, early 2000s. A lot of the elements are still true today. You'll see that it's, effective campus has a coalition, they exercise leadership, that evidence-based programs again, they have strategic planning process, they're evaluating, they figured out how to work towards sustainability. So once the grant funding was gone, they could continue their programs, and they take the long view. They came out with another manual on field experiences to complement that first document in 2010. These looked at 12 programs from 2005 and 2007. So adding on that framework, they said there's a clear alignment to the institution's missions, values, and priorities. We see some similarity there with the ACHA, standards of health promotion. Strategic planning is once again brought up, engaging the campus community in data collection and evaluation. So again, going back to the whole concept of data collection and evaluation, looking at the Department of Ed principles of effective prevention from 1998. We've got that data collection again, and some things that were new that we have not talked about is promoting student involvement. That, this prevention comprehensive program should not just be left to staff and faculty, but we should get the involvement, engagement of students in the planning and implementation of the things that we're doing. Also new is paying attention to strategic timing. Sometimes when we survey, we hear that the average student drinks 5.2 drinks every week. Well, we know that that's not consistent every week. We know that there are some weeks that students drink a lot more and other weeks where students drink a lot less. And we know that from some research, students drink heavier, freshmen drink heavier during the first few weeks of the semester, and then it goes down a little bit. And we know from some research that freshman students drink the most on a week that they're less likely to be on campus, and that's when they're home during Thanksgiving. So we know that there are some times that we may want to do some more prevention work during times where students would drink more, and we could back off a little bit on weeks when students would be less likely to drink. And then they also talked about honing communication skills and marketing skills, which is probably even more important now based upon such high utilization as social marketing and social media. When you're looking at your comprehensive program, also look at evidence-based programming strategies. Again, I would really direct everybody to have some familiarity with the NIAAA's College AIM project. This is ongoing. The first iteration was released in 2015, 2016. I know that there was a revision in 2019. I've not had a fortunate opportunity to interact with Jason Kilmer lately, so I'm not necessarily certain if there's an update on the horizon. But they essentially broke up into two work groups of researchers and professionals and NIA staff, and they looked at the literature that was out there for all interventions related to alcohol in college students. And from there, they basically divide it into individual level strategies and environmental level strategies. And when we look at the website, it also includes some strategic planning worksheets and some frequently asked questions. And this is what the website typically looks like. They may have made some revisions and updates since I've last taken a screen capture of this. But what you will see is that you'll see a link for individual strategies and environmental strategies in the worksheet. If you go and you click on either of the individual or the environmental strategies, it will take you to the page, and what you will see is that there will be different strategies, and the different strategies will be into different tiers based upon cost, based upon effectiveness, and there will also be information based upon how easy and how difficult it is to implement and whether or not there's research available. And then when you click on a particular strategy, there's information based upon the rating and how the rating was determined, staffing needs, target population, research references, and possible resources. So if you're sitting there and you're saying, we want to kind of look at what we're doing and figure out if we're doing best practice evidence-based, or you sit there and say, we know we're not doing evidence-based and we need to be doing a better job. This is a great tool. You can go through and look at different interventions and say, well, I've heard about that, or that looks kind of good. Let's look at it. Okay, that's way too much money. We don't have money for that. Or, okay, that looks good in terms of cost. Oh, that's going to require a lot of staff and a lot of staff time. So we may have to balance that out. Or here's something that doesn't cost a lot, has a high level of effectiveness, doesn't really require a lot of staff time, not a lot of barriers to implement. That's probably something that's more doable on our campus. So it'll kind of help you weigh some of the pros and cons and allow you to look at your campus infrastructure and your campus culture and kind of figure out what may be a better fit for what you can and can't do. This actually shows kind of what the pages look like and in the environmental strategies. So you'll see 3 columns ranging from lower cost, mid-range cost to higher cost in terms of 3 columns. As you go down the columns, you'll see the higher level effectiveness strategies are listed at the top. And then as you go down, you go into less effective. And down at the bottom, you'll find interventions that have been listed that may just not have had enough research that's been published and reviewed to determine whether or not there's any efficacy there or not. If you click on something, for example, here we see restrict happy hours, price promotions, you'll see the greater detail. So restricting happy hours, price promotions as an environmental strategy, tends to have higher level effectiveness. It's a low cost policy intervention, but there are a lot of barriers. You have to get a lot of community buy-in to make it happen. You have to get municipal buy-in. The politicians and elected officials have to buy into it and pass it. There does seem to be a good deal of research to support it. It's got a broad reach, so it would not only impact college students, but it would probably impact the broader reach of the community. In order to do it, you couldn't just have someone out of school that has a health ed degree to do it. They're really going to have to know something about policy. So, if you have a health educator doing substance use prevention on campus, they may not be the best person to staff this project because they may not have the skill or the knowledge to be able to do it. And that's where this information is really helpful in trying to figure out what is going to be a better fit for your campus. As I said, there is a needs assessment. So, the great thing about the planning sheet, which is the next slide, is it allows you to kind of look at your goals and objectives, determine what you're doing, what you may want to do, and do some analysis of pros and cons, cost and benefits, whether or not you can do it or not. And this is a copy of the sheet. So you'll see up here, you would start with the things that you've got going and the things that you could do. Below would be the interventions and strategies that you might wish to do, whether or not they're individual or environmental, their level of effectiveness, their cost, their barriers, broad reach, and then what would be the next steps. I found that this is a great discussion tool to talk about what you're doing, what you would like to do, if you need to get rid of something, what needs to go, if you want to add something, what can be added, and then what are the barriers for adding things, or what are the barriers for getting rid of things. It's a great discussion tool. It's also very helpful during a biennial review process, especially when you get to the end and you're talking about recommendations for the next biennial review period. So again, this particular webinar is really more vague and ambiguous because this is the section where we don't have a lot of clarity and direction from the Department of Ed of what a program is. So I would say language matters. It's really important to have discussions on your campus about what is a comprehensive substance use program. What do people on your campus think that program should look like? What are the elements that that program should contain? What does the current practice and research say about a comprehensive program? How do you look at a social ecological approach and have elements that impact all layers from intrapersonal, interpersonal, organizational, community, and policy levels? And then what frameworks, what standards are you using to kind of create a foundation for your particular comprehensive program? If you're able to develop answers to those questions and develop that infrastructure, it allows you to more easily communicate what it is that you're doing, why it is that you need funding, to key constituents and administrators, but it also helps you set the stage so that way when it comes time to conduct your biennial review, you may have already set up some key performance indicators, some metrics, and some things that you can measure to determine whether or not you're having an impact in terms of outcomes. And if you're not being successful in outcomes, if then at least you're meeting some of your processes. So with that, I would open up the floor to any questions that we might have.
Eric, it looks like we got one question.
Sure, templates. I'm gonna put it in here if I can. I don't know if I can answer. So let's see. Is our web page showing up on the screen right now?
Yep.
Okay. If you go to our web page, if you go over here to the right of resources, so our web page is eiu.edu/IHEC. If you go over to resources and you scroll down to the second link that's called Drug-Free Schools and Campuses Act. The first link that you will see is actually the 2006 Higher Ed Manual. You'll find some past PowerPoints, and when we get done with the webinar series, we'll put up these PowerPoints there. And I think the recordings to this are actually on our YouTube site. So I'm going to ask Jennifer if we can go ahead and put the YouTube links to the videos up on this page, because I think that'll be helpful. And what you will see is you'll see the template for the annual notification, the biennial review format, and the certification. They say 2016. Those are a little bit outdated compared to some minor revisions that I have, but for the most part, they have not changed much. Maybe some typos and things like that. So for more immediate access, Michael, if you want something today, I would direct you to that. I've got some things from 2022 that I'm working on that I just need to make a few last tweaks, and then I need to get them to Jennifer and Madison, and they'll send them out to everybody. And there's a few other resources that we've had. This particular link, if it's not died, if people want to go look up Clary reports to see final program review determinations, what they look like, do that. I'm trying to go find one real quick. Occidental is an example. I wouldn't say a good example, but they're a school that got in trouble for drug-free schools. There we go. So, you know, if somebody wanted to see what a school that got in trouble for and kind of what mediation they had to do and how they had to correct the problem, it's a good example to see what their required actions were. I like to use this one because is this it? Up here on page 52, it's the one that basically gives permission to put the policy out on a web page and distribute it to the world that way. And you won't find that anywhere else. I've not been able to find any text anywhere, but I find that useful. But otherwise, there are some very helpful materials there. Any other questions? Good. Well, thank you all for coming. Again, next week we will focus on the biennial review process. When we talk about that, we'll talk about forming a review committee, elements of that committee. We'll talk about different data points that can be collected to help evaluate and assess the state of your campus. We'll talk a little bit about program evaluation and policy evaluation, and then kind of pulling it all together to do a SWOT analysis and how to make final recommendations to move forward for the next biennial review period after that biennial review report. And of course, part of what we'll also talk about is typically, timelines and when it can be created and when it needs to be done and completed. So thank you all for being with us today. Again, thank you for your flexibility. Sorry we couldn't complete this 2 weeks ago as indicated. We hopefully have the audio issues done, and I'm going to look at the new computer and figure out what needs to happen to correct the PowerPoint issues. I think I figured it out in process today. So thank you for your patience and grace with that. And with that, have a great Wednesday. Thank you all. Bye-bye.